In this video, we're going to discuss on blood in urine. Blood in urine, also known as hematuria, is a condition where there is blood present in the urine. This can be a cause for concern and may indicate an underlying medical condition. There are two types of hematuria: gross hematuria, where the blood is visible to the naked eye, and microscopic hematuria, where the blood is only visible under a microscope. Hematuria can occur in both males and females of all ages, but it is more common in males over the age of 50. There are many possible causes of blood in urine, including urinary tract infections, UTIs, kidney stones, bladder or kidney cancer, an enlarged prostate gland, or an injury to the urinary tract. In some cases, blood in urine may be a side effect of certain medications or strenuous exercise. If you notice blood in your urine, it is important to see a healthcare provider as soon as possible. Your healthcare provider will perform a physical examination and may recommend further testing such as a urine culture, imaging studies, or a cystoscopy. Treatment for blood in urine will depend on the underlying cause and may include antibiotics, surgery, or other medical interventions. One of the most common causes of blood in urine is a urinary tract infection. UTIs are caused by bacteria entering the urinary tract and can cause pain or discomfort during urination, frequent urination, and fever. If left untreated, UTIs can lead to more serious complications such as kidney damage or sepsis. Kidney stones are another possible cause of blood in urine. Kidney stones are hard deposits that form in the kidneys and can cause severe pain when passing through the urinary tract. Other symptoms of kidney stones include nausea, vomiting, and fever. Treatment for kidney stones may include pain medication, hydration therapy, or surgery. Bladder or kidney cancer can also cause blood in urine. These types of cancers are more common in older adults and may not cause any symptoms in the early stages. Other symptoms of bladder or kidney cancer may include pain or discomfort in the lower back or abdomen, weight loss, or fatigue. Treatment for bladder or kidney cancer may include surgery, chemotherapy, or radiation therapy. An enlarged prostate gland is another possible cause of blood in urine in males. The prostate gland is located just below the bladder and can become enlarged as men age. An enlarged prostate gland can cause difficulty urinating, frequent urination, and pain or discomfort during urination. Treatment for an enlarged prostate gland may include medications or surgery. In some cases, blood in urine may be a side effect of certain medications, such as blood thinners or anti-cancer drugs. Strenuous exercise can also cause blood in urine due to trauma to the urinary tract. It is important to note that not all cases of blood in urine are serious, but it is always best to get it checked out to rule out any potential health concerns. If you experience any symptoms such as pain or discomfort during urination, frequent urination, or fever, seek medical attention immediately.
Thank you for watching, and be sure to subscribe to our channel for more health-related content. Stay healthy.